Hi, everyone. Welcome. Um, Thank you all for joining today during the lunch hour. We'd like to welcome the Coalition on Homelessness and Housing in Ohio for this webinar on serving children and families experiencing homelessness. And we also wanted to thank the Ohio Department of Health for their support and collaboration with our preventative health program and with these webinars. This will be our last quarterly webinar for this year, and then we'll be starting up webinars of the month again, like we had last year. You go to the next slide. The link for our resources and trainings that we have had are available on our preventative health program website. We will have our new webinar of the month starting soon, and then there's 1 credit available for attending this training, and I will send the survey out after later today. At this time, I'll go ahead and pass it over.
Aubrey, you're muted.
Sorry about that. I only do that every so often, even though this is what I do for a living. Anyway, welcome, Amanda Wilson and I'm Aubrey Jones. We work with the Coalition on Homelessness and Housing in Ohio. We only have an hour, so I'm just going to quickly kind of tell you, Amanda is an amazing director and she heads up our youth initiative. So she's going to talk today a lot about what we're doing in the state of Ohio around youth homelessness. And then I work in the technical assistance, which is around 8 o'clock in the racial equity committee. Amanda and I both work in that department, and that's at 2 o'clock. And we both do some other things like help with our annual conference. Our job is to support the providers working directly with homeless folks in the state of Ohio. Today, what I'm going to do is give you the basics on the homeless crisis response system. It's organized actually in a very systematic way at a federal level. And so it's no matter where you are in the state, it's just some good knowledge to understand how it's organized. We'll also discuss how we do our work. There's a lot of misconceptions, and frankly, homelessness has come a long way as it relates to evidence-based practice. So we'll just talk a little bit about how we do what we do best. And then kind of what you can anticipate around youth and young adults experiencing homelessness. They actually do have a higher incidence of homelessness, a disproportionate, especially when we're talking about some subpopulations that Amanda will get into. And then lastly, we're kind of going to just talk really quickly through, hopefully we get there. Like if you had a family come in and they're like, I just want to let you know something, we have to be out by Friday. You kind of have a general idea of which way to send them. And there's kind of 2 paths basically. If you'd like to in the chat, because we're short on time, if you want to put your name, where you work, your role, and any specific training expectations, we will try and get to those. So quickly, I want to talk to you about the state of Ohio and what you're going to be seeing why you may be seeing increasing numbers of homelessness. Right now, we have a huge, significant disparity in the working wage in Ohio and then housing affordability. Most folks cannot afford their housing. If you look for every 100 extremely low-income renters in Ohio, there are only 44 rentals units affordable. So there's already a gap right now. And frankly, right now in the state, a lot of folks are not building enough in different municipalities to keep up with what the need is. So it even more increases demand. One thing I want to point out here is 1 in 3 Black renters in Ohio have severe rent burden compared to 1 in 5 white renters. This is something that Amanda and I look at because there's a significant racial disparity in the state of Ohio across every single county and community that we look at and that we work with, even in the rural communities, there's a disparity in Black folks experiencing homelessness at disproportionate rates. Just to give you an idea, where I live in Franklin County, we make up about 17% of the population, and we make up about 70% of the homeless population. Many of those are women and children. Did I miss something? I'm sorry. Okay. So I wanted to talk to you a little bit. A community access point is a community agency, basically. All the places you may go, the food pantry, you may send people to services for counseling, services for after school programs, etc. These are what our system would call a community access point. We want these folks to be able to identify individuals and families that are at risk of homelessness, try to get them into some type of identified resource using a risk referral. In other words, based on how many days till homeless you have and what your situation is, there's a risk response and referral guide that will tell you kind of which way to send them. And then provide housing problem solving to try and identify a safe place, even if it's immediately, rather than going and calling the homeless hotline or calling a hotline to get into shelter. When you call to get into shelter, typically you're going through what we call coordinated entry. This is a HUD standard, and this is why it affects every single basically homeless crisis response system in the United States, but specifically Ohio. What's going to happen is, based on your area and your region, you're calling one hotline. That hotline, the coordinated entry, are the only people that can typically put people in shelter. Typically, you don't call shelter to shelter. Almost every region in Ohio, and Amanda chime in if I'm wrong, but almost every region in Ohio, even the rural counties, have a coordinated entry system where that's the way they are able to place people in shelter when they have no other safe place to stay that night. Their main goal is to 24/7 try to put people in those beds, make sure there's no empty beds in shelter and people on the street, and also make sure that whoever is the most in need of shelter is getting there first. Typically that's families, right, with minor children. And so why this is really important for you to know is because you really don't want someone to call us or the homeless system unless they need shelter that night. If there could be a way for them not to have shelter that night, they can go to a friend's house, they can sleep on their mom's couch, etc. That's what we want them to do, because then we can keep them in the community, keep them engaged. Just to let you know, there's a strict eligibility. This terminologies, and you can read it later if you like, but this terminologies comes from HUD, so from the federal government. And the reason I keep stating that is because that way you understand it is universal. No one really has a choice in how they do this, but you have to have no other safe place to stay tonight and no other options or resources. So what HUD says, for example, is if you have enough money in your pocket to stay in a hotel, you are not eligible for shelter. If you have a friend, a neighbor that you can stay with, and it is a safe environment for you and your family, then you are not eligible for shelter. So that is how HUD decides eligibility. You can imagine with a strict eligibility like this, the reason has to be because we don't have enough to go around. Ultimately, shelter is just a resource to keep people safe and out of the elements. It is not a housing option. And so our goal is to reserve that for people who would be, but otherwise be on the street. We do what we call shelter diversion or rapid resolution. Again, our goal is to avoid literal homelessness, and we want to quickly resolve the problem. I've worked with pregnant and parenting teens for a while in my career, children in my career, teenagers, new 18 out of the house or got kicked out because they weren't being nice, right? And I will tell you a lot of problem solving, if they can stay with their old foster parent and they can bring in food stamps and put food in the house, and if I can get their utility assistance turned on and etc. and support the family, it's better for us to problem solve and strengthen an at-risk family than it is to serve them after they've already become homeless and entered shelter. I was going to tell you a little bit about some of these best practices because they may be new to you. Housing First is an initiative that says that housing is what resolves homelessness, and housing is what needs to be paramount and coming first. And the reason for that is that, as you can imagine, when we have people wait till they get a job, save up the money, do what they need to do, get transportation, it's very difficult, maybe complete a program. It's very difficult for them to make progress and actually get to housing. And frankly, what we found was that long-term work your way to housing wasn't as effective as what Housing First is, which is as quickly as possible, we are going to end your homelessness and get you housed by any means necessary in a safe, right, hopefully affordable unit where you can stay until you get to your best next, right? That might be shared housing if you're a single adult. People that are informally incarcerated oftentimes will have to go to shared living because it's really the only landlords that'll take a chance on them. But our goal is to quickly stabilize them into housing so that whatever they have to do, they can do next. Think about it this way. Is it easier to get a job when you're housed or when you're on the streets and you have no access to shelter and water and transportation, right? So we have had significantly better outcomes as a nation doing Housing First. Harm reduction is a way to show up specifically with folks that use alcohol and other drugs, illicit drugs. It's a way to show up that respects them as a human and is very non-judgmental. And what it says is basically it comes from a place, and this may resonate with you as physicians, a place of caring. I care about you, and so how can I reduce the harms associated with the behaviors and the environments that you're in because of your drug or alcohol misuse or use? So that doesn't just look like dropping off syringes and needles or test kits for fentanyl. It literally is about showing up, building rapport and relationship, and constantly letting somebody know that they have the ability, using motivational interviewing, they have the ability to make changes in their life and that we're there to help them when they're ready. It's a way to make sure that the folks that are at the most vulnerable, right, and hardest to engage have somebody that they feel like they can go to and on their side. And we have to build relationships and bridges to what we inevitably know is going to help them best in their life, which might be reduction or abstinence. Crisis response. We are the ER. So I tell this, it's funny that I'm using this analogy, but I use it all the time. The homeless crisis response system is the ER. If you are not dying, we are not the place to call. If you have a cold and you have a cough, we are not the place to call. Yes, you need to see a doctor, but we are the ER. And frankly, if it's not a crisis, like I said earlier, if you don't need shelter tonight, we're always going to turn you away because our goal is to try and prevent what happens when folks are on the streets and in the elements. We have consumer choice. A lot of folks may think you come to shelter, you sign up for a program and they put you in this house. A HUD standard that we are required to have is consumer choice. We can't just put you anywhere. You do have decisions now. You may not have decisions as it relates to your rentability or as a tenant. You may only have one landlord that's willing to work with you, but it's still consumer choice. Progressive engagement is about saying, I'm not going to just show up and give everybody the same thing. I'm going to give everybody exactly what they need. And if I see that they're struggling to make progress in their goals, I'm not going to pull away. I'm going to come in and scaffold. For those of you that have gotten, continuing education and youth development, it's similar to youth development. And then trauma-informed care, I'm sure many of you heard of, but obviously homelessness is kind of what happens as a byproduct of what happens in folks' lives. And if you're familiar with ACEs, trauma significantly impacts a person's life, and it's not just their physical health, it's their emotional health, right? It's their decision-making, et cetera. And so oftentimes we are working with folks that have experienced some type of trauma, usually multiple traumas, and that isn't necessarily what resulted in their homelessness, but you're more likely to become homeless, right? If you have poor decision making, if you have a history of trauma, et cetera, right? I'm going to hand it over to Amanda just to go over a little bit with youth. Amanda and I both have a career or a background in youth, and so we're really passionate. So please listen. Youth homelessness in Ohio is a big deal, and it's solvable.
Thanks so much, Aubrey. So this graphic, you may have heard of Chapin Hall and the Voices of Youth Count studies and information. Really highly recommend their website, Voices of Youth Count, so that you can learn more about what is happening with youth experiencing homelessness around the country. But we really need to highlight one population. So we talked about racial equity, so that's an issue. So we know that our Black and brown young folks are experiencing homelessness at a disproportionate rate. And so any effort to combat youth homelessness has to be pursuing racial equity. So how are we creating welcoming environments? What are we doing to mitigate the effects of systemic racism for our families and our clients? And then this slide is specific to our LGBTQ plus youth, who are more likely to experience homelessness than their non-LGBTQ plus peers. And you can see there's just a whole host of dangers that our LGBTQ plus youth are experiencing when they come into homelessness. So youth can be, rejected by their families, and so we have that discrimination or stigma. We have increased incidence of both self-harm and harmed by others. And we also have increased incidence of human trafficking for these young folks as well. So it's really important to be, again, welcoming in your environment. And if you have expertise on LGBTQ plus issues, making sure that your young folks know that. If you don't, seeking that education out so that you can be ready to serve those young people effectively in a way that will help increase their health and safety. So when we're talking about homelessness for young folks, we've talked about HUD. You can go ahead and go to the next slide, Aubrey. HUD definition homelessness. So housing and urban development has its own definition of homelessness. And then the education system has its own definition. And so the McKinney-Vento law, it just says that any student that doesn't have a fixed, regular, or adequate nighttime residence is considered homeless. So when we're talking about services available to young people in the school system, when we're talking about certain types of youth programming that are available in some communities, such as runaway and homeless youth programming through Health and Human Services, we have a much broader definition of literal, of homelessness that we can use, because we know that young people are often doubled up. And so they're not always on the street, visible, visibly experiencing homelessness, for instance, on the street. And so we just have some examples here. So we do have, living in your car, out on the street, but we also have substandard housing, abandonment, that, again, those doubled up situations. So if you go to the next slide, Aubrey, McKinney-Vento Homeless Assistance Act. Under that, every school district is required to designate a liaison for children and youth experiencing homelessness. And that liaison is responsible for coordinating services to make sure that youth experiencing homelessness are able to stay in school. So that's always, if you haven't already formed those partnerships in your community, it would be ideal to reach out to your local school district and or educational service center to find out who's the liaison in my area. And if I'm serving a family with children that is experiencing a housing crisis, and I'm working with a young person, how can I make sure that they're getting connected to the services that are available to them? If you go again to the next slide, we know that homelessness has huge impacts on learning. And that's one of the reasons that the school system is involved in making sure those young folks stay in school. So you can see, again, this is from the Chapin Hall studies, which I, commend to you to check out. But just these huge numbers about dropping out, difficulty staying in school, lower, you're back in presenter mode, Aubrey. Lower educational attainment, and achievement gaps, just huge outcomes on learning. And we know that this is a cycle, because then if you're not meeting your learning outcomes and getting your educational attainment, you continue to be at increased risk for homelessness in the future. So it's really important that we keep our young folks enrolled in school. And I got ahead of myself. So we talk about that on the next slide. So education as a preventative. So making, connecting young people with their supports at school, making sure our youngest children are in preschool programs. I'm sure I can tell by your positions that you shared in the chat that many of you are familiar with Head Start and Early Head Start. We're making sure that young children are getting enrolled in preschool, and just, again, getting that high school diploma, and then, being able to move on, because now we know even that is difficult in the employment market. So on the next slide, how you can support, again, it's about forming relationships and building trust. So these are some of the things that liaisons do, but we're looking at transportation options, making sure young people can get where they need to go, partnerships with community-based organizations. So I know a lot of you are doing that already, but making sure that what the youth dedicated programming, if there's youth dedicated programming in your area, that you're aware of it, and that you're making those connections. And then always being person-centered and allowing the family to let you know. It's easy when we're working with families that are in crisis to be like, okay, I know exactly what you need, and here's what we need to do. But it's really important, especially when we think about trauma impacts, to allow folks to define what their goals and needs are and what they're looking for when they're seeking services. So we're going to talk more about trauma, but just quickly on the next slide, just thinking about what assumptions are being made and how you're responding. I'm sure you're all doing that already, but just being thoughtful and empathetic in your responses, which is the next slide. Active listening, building relationship. I will tell you, working with youth and young adults, that is what young adults tell me all the time, is that they want to be treated with respect and dignity. They want to be trusted and believed. They want those genuine relationships and that trust. And then how are we providing hope in a particular situation? So how, not being glossing over difficulties, but how are we providing some options? So just some different resource partners, thinking about, again, we talked about childcare, depending on your area of expertise, making sure that you have other health and mental health providers, referrals in your pocket, your local community action agency, your local children's services, and job and family services office. And if you have any 24-hour crisis response in your community, making sure that you're familiar with that. And we have lots of links in our slides, but something to think about if you want to learn more, you can go to the slide 23. Yep, this one. The Ohio Department of
Those tech
Education.
issues.
No worries. The Ohio Department of Education has a lot of information. National Clearinghouse on Homeless Education has a lot of resources, Schoolhouse Connection. This has a Columbus reference, but, looking for your local homeless coalition and professional development opportunities, just making those connections. I know we're all busy. We all have our area that we're focused in, but as much as we're networking and building relationships in the community, that's how we're going to get young folks experiencing homelessness and families connected with the services that they need. Aubrey, was there anything else you wanted me to cover in this section before I turn it back over to you?
No, I think that's great. Thank you so much, Amanda.
All right, thank you.
I'm sorry for the tech issues. I don't know what's going on. Oh, look at that slide. So just to give you a background, my background is in trauma in therapy. You may be familiar with Bruce Perry. I started in early childhood development, early childhood mental health. That's kind of where a lot of looking at trauma in the brain is specifically around, right? What happens 0 to 3 when you don't have a primary caregiver, you might be in foster care, et cetera, your caregiver's experiencing domestic violence, all of that good stuff. So I worked a lot with trauma in young kids. And so I use that knowledge now to train our staff and everybody that's working in the homeless crisis response system with understanding what traumatic stress is and how it impacts the brain, the science behind it. Obviously, I'm not going to go into it, but I usually go into a little bit of the science because it's important for service providers to know that it's something that's chemical in the brain. This is not someone deciding to be disgruntled or deciding to be apathetic. It's a response to the stress overload. The other thing I talk about is how this impairs executive functioning. You want to talk about the worst time to have impaired executive functioning, right, is when you're experiencing homelessness. I can't even imagine, right? And so it's important for us to understand this because if your brain is offline, if you're not thinking straight, because you're experiencing this traumatic or toxic stress, it's important for us to intervene in a way that tries to calm some of that down, tries to minimize that. So it's important for providers to know how this impacts executive functioning, specifically, right? Like an overload or override of behavioral and emotional responses to engage goal-directed behavior. When that goes offline, you might tell a case manager, right, who you think isn't helping you, exactly how you feel, right? Even though she's helping you get housing, and that's your goal. We also talk a little bit about the individual differences in executive functioning. Oftentimes we're not talking about these things in isolation. We're talking about someone that may be aging, has been living in poverty, has physical health issues, has a long history of alcohol and drug use and mental health experiences, right? Has had some stressful life experiences because they've been living on the street, et cetera, et cetera. So you can imagine how these can impair executive functioning as well. But because we're trying to quickly resolve someone's housing crisis and we need them to problem solve, we don't know the answers, it's important for us to recognize that at some level, we have to get them back online. So we talk about what helps, and this can be for even in a 15-minute consultation. If you refer somebody to the nurse or the social worker to have a bigger conversation and they have 15 minutes, right? Maybe somebody else, a nurse, takes the kids, right? And it's just mom in the room, because everybody knows if you're a mom, right, it's hard for you to have a fully tuned in conversation. So you want to remove the stressors in the room, right? Even if she's not expressed it. Hey guys, want to come get a snack with me? we always talk about helping yourself as well as people that you're talking to, but also avoid additional stressors. So you want it to be focused on what this person is experiencing with the housing crisis. You don't want to say, so let's say you've referred, Junior to a follow-up evaluation for autism. I'm saying, just kind of making this up today in the session. This is not the time for that nurse when they're talking about the housing situation to be like, don't forget to, take Junior to that referral. See what I mean? Like, you don't want to make it their brain function offline. Like, you don't want to put additional stressors in, even if it's factual. You want them to understand that they need to help this. I'm sorry, I have something flying. You want to reduce the perceived importance of this situation, and this can easily be done by referring them to a community service or the homeless hotline. And all I would say is, listen, this is what these folks do for a living. So clearly they have done this, they have helped people, I'm sure, in your situation. And if you go and make that first call, you're already doing the right thing. Increase perceived control over the situation, exactly what I said. You know what? You telling me today, Ms. Jones, that you needed help with your housing situation, or that you were worried your kids are going to be on the street, was the exact thing you needed to do. You know what to do. It's just going to take some time, and you have to, ask people for help, etc. As you know, we always talk about people taking care of their basic needs, their diet, exercise, sleep, etc. Any of that stuff that they can maintain is going to help them, right? Be a little bit more mindful. The more mindful you are, the less you're having traumatic thoughts over and over again in your head, basically. Kind of escaping, if you will, mentally. So we also talk about how we empower clients. We talk to them, like I said, and help them view themselves as somebody who is strong and able to overcome this. What causes homelessness? We get this question a lot, and it's really important, right? Because we know that it's not drugs and alcohol. It's not people facing domestic violence, just having mental health issues. If everyone that had a mental health issue, a drug addict, was a domestic violence survivor, etc., we'd have way more homelessness problem. So blank plus X equals homelessness. The X is poverty. Frankly, when we have people who don't have enough to meet their basic needs, or on the edge of just, every paycheck goes to every single bill, any little crisis can cause them to experience homelessness. So what do we want to do? We want to try and help people with problem solving work. This is kind of the boiled down version of what a case manager might do, but basically we want to help them determine if there is anywhere else to stay. As you know, especially folks with children, a shelter, being homeless, the whole experience can be extremely traumatic, but going to stay at grandma's for 2 weeks, not so much. So having them find anywhere else. I'm embarrassed to ask my mom to stay. I don't want her to know I'm being evicted. Embarrassment is not a good enough reason to come to shelter. So what you're trying to do is help them understand that's what you have to do for your family, then you're doing the right thing by them. Anything you can do to link them with financial assistance. What I would say to folks like you that may not have, like, oh, I know the exact spot to send them to any case manager. If they have home visiting, say, hey, when you talk to your home visitor next week, I need you to talk to them about this and whether or not there's financial aid. So send them somewhere that is the people who have a little bit more training, right? And they do this for a living. And those can be home visitors, social worker at the WIC office. I might have this slide somewhere, etc. Being doubled up and staying temporarily with friends and family is okay. And frankly, sometimes because the household enlarges and there's additional dependents, they may be eligible for additional benefits that will help with the additional burden of having more people, such as additional food stamps, utility assistance. I always get on my kids especially now that it's boiling hot, close the door. Kids are good for letting your air out. So, having that utility assistance is really important and goes a long way so that they're stably housed and they don't have a $500, electric bill at the end of the summer. We talk a lot about the identifying support systems. Oftentimes, especially if you're going through trauma, you kind of hunker in and you close yourself off to especially people that are in that middle, outer, and beyond ring. You're a little bit more guarded. And so going through and saying, who are those close within reach and arm's length people that you may not have thought of? For example, your boss at Chick-fil-A, remember he told you he owns rental properties? Since you're such a good employee, maybe he'll take a chance on you. That's that outer ring, but it's still an identified support system. Maybe it's just asking him for additional hours, right? Close might be, I know you've been struggling with childcare and keeping a job, especially if a child has an illness that's not ideal for a childcare setting, right? What about, I know you don't get along with the mother, the paternal grandmother, but you've told me that she really loves him a lot and always treats him well. Maybe she could keep him, right? In other words, you don't have to tell her all your business, but is she close enough and do you trust her with your baby? She's going to love on your baby, then yeah, that might be something that's going to help you. So we try to do that exploration with them about their networks. We also focus on strengths, skills, successes, and again, relationships. Strengths and skills and successes. This is stuff like, okay, so tell me what's going on. Oh, I see here you're unemployed, but you did a phlebotomist 4-month program and you graduated, even though you've been unstably housed, you graduated from that. Okay, so maybe that's something we need to think about. So you've already overcome a lot. You know how to get the job done. I bet you're a hard worker. Maybe if we link you up with an employment specialist, you could get a really good paying job in the training you have instead of working at Taco Bell or wherever you might be working today, right? We also want to talk about successes. Ms. Jones, I see here that this is your first time experiencing homelessness and you're 32 years old, you have 4 children. Clearly you've been doing something right. You've been stably housed this whole time. You probably just fell on hard times. You've been stably housed before. You said you were in this apartment for 5 years. So you can do it again. It's going to happen, right? So just letting them know. Questions to reality test. We always want a reality test, again, partly because that executive functioning is offline. For example, somebody who says, yeah, I'm going to get a job doing Uber. And then once I save up, I'm going to be able to get rent. But they don't have a driver's license or a car, right? That's not a good plan. So just reality testing is basically what that means. Making sure this plan makes sense. And it's their plan. So you want to make sure that you're asking questions that they can ponder and give the answer to. Okay, I might be going a little too fast, but we'll have good time for question and answer. This is a lot of content and I just wanted to make sure I get through it. So if you're responding when immediate shelter is not needed, we want you to send those, I'm sorry, let me make sure this is right. Yeah, category, we call it category 3. HUD has categories and internally those are used for folks that know what that means. But this is for folks that don't need shelter tonight, but might need, mediation with the landlord because, they're putting them out for a reason other than non-payment. Referral to legal aid, referral to financial assistance. So we want you to help facilitate that. And provide linkage to any type of needed assistance for critical needs. You want to leave that person with idea. If this doesn't work out, here's a number to homeless outreach or the homeless hotline or a drop-in center, because you may not see them again for however long. So if that plan fails, you want to kind of at least know that in an emergency situation, you still gave them the information. The other thing that you can do is help send them to places that do this kind of work. We don't often think that places that do documents, in other words, they help you get vouchers for birth certificates, state ID, etc. We don't think of these places as housing stability, but as you may know, if you've rented before, you don't just need your birth certificate, you need the birth certificate sometimes of everybody in the household, including the children. And if I had a baby a year ago, I may and been on hard times, they may not have ordered their birth certificate or may have lost it. So those can be a reason why somebody is not able to even apply for housing to get going. With employment, sometimes uniforms are a problem, and sometimes it's training or work readiness. We have a lot of folks, right, that might be underemployed or working a job that's just never going to give them a livable wage enough to maintain stable housing. So it's important for us to think about, you know, someone who's at risk and really struggling, and they were almost evicted and then something came through, but you know, this is just, you know, inevitable, that's going to happen again. Connecting them and talking to them about any employment resources may not make sense because you're talking about housing, but really it is. The best thing to stabilize them is, right, try to get them a better job before it happens again. And then transportation is a big one. Obviously, if you have ever taken public transportation, you know, going to work and having a doctor's appointment in the same day is, you know, working an 8-hour day is probably not doable with transportation, but it might be doable for you and I. So stuff like that can be really tricky and difficult if you have an appointment and you work a full-time job. Most places, not all, most places, all places in Ohio have what's called PIP, P-I-P-P. It's utility assistance. The Breathing Association in Franklin County is one place that does this. The Breathing Association is one place that does this for our folks in Franklin County, but they make sure that the heat stays on in the winter and you stay cool in the summer. You usually pay 10% of your income. And so this can be a way for somebody who needs every dime to pay rent because their, you know, housing is so expensive. The goal is to get all their other things that, you know, they're eligible for, get those costs down. Rental assistance. So we've, if you were reading on the news about the CARES Act, yes, we got a large influx of rental assistance in all the states and specifically in the state of Ohio, but that's really unique and related to the pandemic. Typically, the only rental assistance, quote unquote, on the streets, you know, all the time or available in the community is through Job and Family Services. It's a program called PRC, Prevention, Retention, Contingency. It works differently with every single county department of Job and Family Services. Here in Franklin County, you can submit an application online, but your county might be very different. Oh, someone asked, did we get new funds for housing recently? Yes, Ohio does have more rental assistance coming and it will be hitting the streets soon, but it isn't technically available to someone who needs it right now. The agencies don't have the money yet from the state. I don't know when that's happening because that's not my side of Ohio. Amanda, do you know? No problem.
No, my guess is well, I want to be diplomatic, but it will take a while because it's through the state, you know, budget and legislation process. So,
Okay.
yeah, but I'll see if I can find anything to follow up, but yeah, it'll take a bit. And
one thing I'll let you know, with the last influx of rental assistance that came in, because it was the CARES Act, et cetera, it came in quickly and it had to be spent by a certain date. And so we were just trying to push it out there. I'll make sure I email Alex and kind of I have my group and my network that I plan on just emailing and being like, hey, you should be seeing it in the next month or so. You know, if response for funding, you know, is open, then we'll know it's only a couple months away, et cetera. And I'll let you know, so you can make sure you're sending people that way. The other one is FEMA. Everybody gets Hands on Central Ohio, by the way, obviously is only for Central Ohio, but you may have a 211 in your area, and that is the best place to call. FEMA funding is an allocation. It's usually by, I think, census tract or zip code. I can't remember. They give so much money, some calculation from the federal government for rental assistance annually. it's the federal government, so you never know when it's coming. It's, in other words, it's allocated, I think, January 1st, but sometimes it comes in April and sometimes it comes in June and sometimes, right? Like, it's just, I don't know how that happens, but that's been my experience when I worked with FEMA dollars. And then once they're out, they're out. So you might get 30,000 for a certain area, and 30,000 goes really quickly if you're helping families pay rent. The other thing you want to think about is reunification services. Maybe you can't afford your housing, but can you afford a plane ticket or a bus ticket? You said that you lived with your mom for the first 5 years, you know, that you had a baby in Atlanta. Maybe that's a good place to go back to and get on your feet. So thinking about reunification as a way to stabilize, especially I would say with young parents, they may have been out on their own, right? They're grown. That's what my kids like to say. But, you know, when you have a baby, sometimes it's time to go back home because now you can't make the same amount of mistakes that you would have made as a single 19-year-old, right? It's you got something else to worry about. As I said, linking back to case management, if they have mental health case, if you know parents have mental health case managers, if you have settlement houses or community houses in your area, if they have evidence-based home visiting programs that they're linked with. Most WIC offices don't have full-time social workers, but they do have social workers. Children's services programs in Ohio. So a family can call typically children's services. In Franklin County, it's called Parents in Need of Help or something like that. But basically they can open a voluntary case and get a case manager and services. They're typically referred to a program called Family to Family, where they basically have somebody in the community at a community agency serving the family kind of more locally in the neighborhood. And then think about special populations. So if you're working with youth or LGBTQIA folks, folks that are reentry, returning from incarceration, or expectant women, oftentimes there's special programs in the community for these. For example, as Amanda said, we have specific funding for youth experiencing homelessness, or if you're working with young parents that are under the age of 25, right, you might want to refer them and see if there's specific youth programs available. Not only are they going to cater to that person's needs specifically, right, but they're also probably going to have specialized services specific to that, what they need. Oh, we have a question. Has any assistance or resources with storage units for personal items? So it depends. Yes. So having your personal items stored in storage for people that are at experiencing homelessness, it depends. And this is, by and large, our funding coming from the government, by and large, cannot be used for storage and would not be used for storage because we don't have enough to go around. So we're going to typically allocate most of it to rental assistance rather than, which ends their homelessness, rather than the things they need. Technically, there are some aspects of funding that we can use for that. There may be certain locations that do that. I would say it's more likely in your area if it's a rural area, and if you double up and they play for storage is cheaper than trying to find you shelter in the next county kind of thing. But usually you're only going to see that if there's justification, but it is something that's a documented need. The other thing I've seen it used for typically is folks that have been outside for a very long time have a huge attachment to their things, and but for putting their things in storage, we would not be able to get them housed. So they may do something like that, but that's typically when you've tried for a very long time. Typically, though, you won't see programs that pay for that. And it's definitely a need. And I would say it would really complement the homeless system, because we have folks that won't go into shelters, won't even go into shelter in winter because they don't want to leave their stuff. We talk about tenant-landlord relations. Oh, wow. I can't believe I went through that so fast, but at least we have time for questions. These are great questions. Someone else asked about support for IDs and birth certificates. I don't know where you're located, but the public health department is probably your best bet. So where you would get the birth certificate, they probably know, because they're the ones getting the voucher, who in the community has the vouchers for birth certificates. IDs, excuse me, typically I would say a community action agency is going to have some type of funding for IDs. Amanda, can you think of any other places?
Yeah, I mean, it just depends. I know for young people, some of our youth dedicated housing, homelessness and housing assistance programs do provide money for documentation. So I know this whole presentation was being able to be put on in part with partnership with the Ohio Department of Health, and they have a homeless youth program that does not cover every county yet, but covers several counties. And that is an example of a program that allows funds to be used for documentation. There's a HUD funded program called the Youth Homelessness Demonstration Program. Sometimes those funds, and that's in mostly urban areas. We do have a couple rural locations, but they sometimes can cover costs for documents. So it's really just about getting out there and getting to know what's in your community. And like, as far as youth dedicated resources, I definitely don't know everything, but you can always reach out to me, and I will do my best to link you up with who you need to talk to in your community. So many great partners already on here. I see folks from managed care, and I know that they sometimes have resources. So even within this room, just making sure that we're getting connected with the different services that we provide, and just really getting to know what's going on in your community. And Cohio is always willing to assist with that, and also to provide additional training to folks at your agency or office or in your community. If that's helpful, we can facilitate those conversations.
Any other questions? You're welcome to come off mute or put it in the chat.
Thanks for sharing resources too, and just wanting to direct your attention to the evaluation. Make sure you complete that. And I'll take a risk in speaking for Aubrey and saying that we were just so happy to be with you today. And just make sure, to reach out to Cohio at any point that you need anything in the area of homelessness and housing, and we'll try to get you connected. But we do have a few more minutes for questions if anybody's got any.
Thank you again for your time.
Thank you, Aubrey and Amanda, so much for presenting. It was wonderful training. I put the link to the post-survey evaluation and to our resources in the chat box, and this will be available for CME credit, as well as on our website, and I'll send slides out too.
Have a great rest of your week.
Yeah, thank you, everyone. We appreciate your time and attention. And again, don't hesitate to reach out to us.